Hi, my name is Mojdeh, and I lead the Infection Prevention Division for 3M Healthcare Business Group. And here to talk about the consumerism in the healthcare, and actually with the changes that are happening in the insurance arena and the higher deductibles that the patients pay, as well as the co-pays that they pay. The patients traditionally who've been given care, actually they're seeking care as consumers and looking and shopping for the best value of care that they can get. And as such, they're looking for convenience, they're looking for access, they're looking for choice, and they like actually the fact that they can look transparently and see what services are offered by the providers. And at what price, because before they didn't have a lot of transparency and visibility to it, so they actually appreciate that. Another thing that's going to change now these days for the healthcare providers or the retail stores that are offering care, are offering the primary care to the patients, is that they have to care a lot more about consumers and their loyalty and the satisfaction overall, patient experience, the consumer experience. This has been something that hasn't been on the radar in the past, so that's something that they have to be very cognizant on, because obviously if you're a healthcare system who is trying to get into consumerism and retail for healthcare, they actually are competing with these retail companies and chains that are very much known for patient experience and the loyalty and the brands that they have are very well known with the consumers and patients. The other thing that I think is a key factor in consumerism is that more and more people are caring about preventing conditions for them to happen. So rather than going to the hospital, receiving care afterwards, it's all about prevention and having that convenience to be able to go and to a clinic and see who you want to see at your convenience is going to be a huge deal. Another key enabler, obviously, in this retail healthcare environment is the digital arena and the capabilities that we have with e-monitoring or the opportunities to be able to see your records, through be seen by a physician or a nurse practitioner through the web. So these are all enablers that actually are supporting what we want to do in the healthcare, which is to move the care and the cost of care to the lowest cost setting, which is outside and in the communities that we all live in. So that's all